So in today's video, we're talking about knee pain, what you can do at home to manage knee pain, and then what could also look at the various factors that are causing or that could give rise to the development of knee pain. Welcome to Vital D. All we do here is to bring health tips closer to your nearest doorstep. So today we're discussing knee pain in general. Now, knee pain is one of those conditions that a lot of people are facing, and a lot of factors could give rise to knee pain developing. So one of those factors that could give rise to the development of knee pain is injury. Now, injury is one of those things that could give rise to a development of knee pain, and those injuries, we look at ligament injury, for example. If you have a ligament injury, that could give rise to knee pain developing, and once you're having knee pain, you know how painful it is. You also look at the meniscus injuries, for example. Meniscus injury is also one of those things that could give rise to the development of knee pain. Then lastly, for injury session, we also look at fracture. Now, if you have a knee fracture or a fracture around your knee, you're also going to have knee pain, and you know those pains are very severe that you don't need to take for granted. We also look at medical conditions. Now, some medical conditions could also give rise to the development of knee pain. For example, osteoarthritis, as the case may be. Now, those are degenerative conditions in which your cartilage is continually wearing out. So, and over time, and once your cartilage is wearing out over time, it means you're going to have pains around your knee, and then you're also going to have you are going to experience stiffness, and sometimes you are going to have reduced movement. So you have to pay attention to what is happening around your knee, because once you're able to know all these things, that is when we can now start talking about treatment. Another medical condition that could cause is rheumatoid arthritis. That's basically like autoimmune condition in which your body produces antibodies against its own body. So now those things will lead to inflammation of the knee, especially around the joints. So once there is inflammation, that could give rise to severe knee pain. So that's another thing that could give rise to knee pain. Another thing that could give rise to knee pain is gout. Now, gout is just once you have uric acid crystals that are deposited around your joint in your knee, those things will give rise to knee pain. Then lastly, another factor that can cause knee pain is septic infection. Now, bacterial infection around your knee could also give rise to knee pain. So what I've listed so far above are the major causes of knee pain that you don't need to take for granted. You know why I decided to list those things? Because once we know what is causing your knee pain, we can easily tackle it, and then we can treat them, because our aim is to ensure that you have healthy living and you can move very well. Your knee cannot slow you down from going to where you're supposed to go or living a healthy life. So now we have talked about what could cause knee pain. We're also going to look at treatment, and then this treatment I'm going to factor it into two. I'm going to look at pharmacological treatment and then non-pharmacological treatment. By pharmacological treatment, I mean the use of medications, and then non-pharmacological treatment, I mean what the simple things you can do at home, or the simple activities you can do at home to ensure that your knee pain is being reduced. So now, starting from the non-pharmacological pain, now we are going to look at exercise. Now, exercise is one of those things that is physical therapy. Now, physical therapy is one of those things that could reduce knee pain. Then another thing we also look at is the use of ice pack. So once you raise your leg on a certain thing, then you place ice block or ice bag around that place for some time. That could reduce the pain around your knee. So those are non-pharmacological things that you can look at. Then you also look at what you are eating. And what you are eating could also help you to reduce knee pain, because some basic vitamins and the nutrients that your body needs, those things are not medications. Those things are what you are eating. So what you are eating could also be a way of enhancing that you have effective knee. Then we now look at pharmacological treatment. Now, pharmacological treatment management of knee pain, we can now start looking at some basic drugs, ranging from the over-the-counter medications in which you can be given some certain class of NSAID, that is a pain relief drugs, medications, in which that could also be used in the management of knee pain. Then we also look at some injections like the corticosteroid that could also be used in the management of knee pain. Then lastly, surgery could be done on your knee depending on how bad or how your condition has grown to. So that could also be done for you to reduce knee pain. So I'm going to list some 4 nutrients you could add to your diet for you to enhance or to help you manage knee pain. That is very, very vital. So number 1 on our list is vitamin C. Now, vitamin C, aside being a very powerful immune booster, also plays a vital role when it comes to production of collagen. I know collagen is very, very important when it comes to enhancing a healthy cartilage. So always ensure you add vitamin C to your diet. And the source of vitamin C, like we have mentioned earlier in our previous videos, we now talk about a citrus fruit, we talk about red bell peppers, and then the rest. So adding those things to your diet could also enhance that you are enhancing excessive production of collagen, which would in return gives rise to production of enhanced LD cartilage. So always ensure that you are taking enough vitamin C. Then also look at vitamin D. Vitamin D also very, very important, and it ensures that you have a healthy bone. So look at it and then add that to your diet. Then also look at calcium. Calcium is also very, very important because it also ensures you're having healthy bone. Then lastly, omega-3 fatty acid. Now omega-3 fatty acid that could be gotten from fish, walnut, those are also very, very important when it comes to the management of knee pain, because they reduce inflammation around your knee, thereby reducing the pain around your knee. So adding these four things, these four nutrients that we have mentioned, could also help you to manage knee pain. Then lastly, I'm going to talk about tips for staying healthy and then preventing knee pain occurrence. Now, always stay active. Moving around from one place to another while at work or your environment, or you wake up from, as in not being active, could also prevent the occurrence of knee pain. So always seek medical assistance on time, because once you're able to know what is causing your knee pain, you can easily get medical treatment on time, and that will help you to reduce and then manage yourself effectively. Then always ensure that you're adding effective nutrients to your diet, because once you're eating healthy, you're adding those nutrients like I mentioned, vitamin C, eating those kind of, ensuring that your body produces enough collagen, thereby enhancing that you have healthy cartilage. That will also enhance that you are moving very well freely from one place to another. So with this, I want to encourage you to ensure that you are paying attention to what is happening around your knee. Always seek to understand why are you having knee pain. Once you're able to know what is causing it, you can get treatment and then return yourself back to normal, so that you can move freely without any obstruction. Thank you so much for watching our video today. I encourage you, if you have not subscribed, please subscribe, share, and then tell us what you want us to talk about in our next story. Alright, until then, see you next time.